to episode 5 Ethical Leadership in Health with Dr. Mahesh Devnani of our podcast series Health Frontiers Insights from Global Experts. We will look deep into the world of healthcare with some of the bright mind in the industry. I'm your host, Dr. Ishwita, and today we have a very special guest with us, Dr. Mahesh Devnani, sir. He is an additional professor of hospital administration and joint medical superintendent at PGI Chandigarh. With over 18 years of experience in medicine, public health, and healthcare administration, he brings a wealth of knowledge and innovative perspectives to our discussion today. Welcome to the show, sir. So my first question to you is that as in your position as joint medical superintendent, you are often faced with difficult decisions that can impact patient care and hospital operations. Can you share an example of a challenging ethical dilemma you have encountered and how you approached it being a leader?
Yeah, sure. Firstly, thank you very much, Ishwita, for having me for this podcast. And this is a very important topic. And thank you very much for this question. Not just me, but every healthcare worker faces some or other ethical dilemma almost every day. And especially if you're working in the resource constrained settings where the mismatch between the demand and supply is high. Talking about the example, there's so many examples I can give you. For example, the recent COVID-19 pandemic, when that happened, and there was a huge demand of ventilators at that time, and then we had very limited supply of ventilators. So how to provide ventilatory support and mechanical ventilation when the demand is too high? How to prioritize that? What are the scientific clinical decision-making frameworks, algorithms you use to prioritize and then ethically decide those things and communicate those decisions to them? This happened in the H1N1 swine flu epidemic as well. This happened when the vaccine was made available for COVID-19, how to prioritize the vaccination. Why should it only be given to the healthcare workers and the frontline workers first and not to be given to the others? So why there was a value in giving them first, why it was more important for the normal functioning of the society. Another example I can give you of the mucormycosis epidemic that happened along with the COVID-19 pandemic. Specifically, it happened in some parts of this country, and in the north it was quite prevalent because of as it has been said, that because of the indiscriminate use of the steroids. We received a lot of patients of orbital mucormycosis, facial mucormycosis, and one of the drug cure for this mucormycosis is the amphotericin B. And the availability of amphotericin B, especially the liposomal amphotericin B, was very less, and it's a very costly drug. How to prioritize availability of that, distribution of that amphotericin B? Which are the patients we should give the amphotericin B, because every mucormycosis patient couldn't be provided with the liposomal. Then we had to give the non-liposomal, which is the other, and it is more toxic. Liposomal is better tolerated by the body. And how those ethical decisions are made in a fair and just way, which keeps the patient's trust intact rather than, bringing mistrust among the patients that the healthcare is discriminatory to them. So there are so many such examples, not just during the epidemics and pandemics, but also in the day-to-day practice. Also, for example, in our ICUs, in the cadaveric transplantation, in the allocation of the cadaveric organs. Another, I remember, not happened during the COVID to some extent, but it happened more during the H1N1 influenza, where some of the healthcare workers were very apprehensive about their health and health of their loved ones. And then they were a bit reluctant to perform duties in the what we called a CD ward, that is a communicable diseases ward, an emergency, because there was a huge rush of patients having the H1N1 influenza-like symptoms. Not necessarily they were positive, but they were had influenza-like symptoms, and they were likely to be, positive. And then at that time, some of the healthcare workers were reluctant to provide services. So how to make sure that the healthcare services are run smoothly uninterrupted, at the same time take care of the needs of the healthcare workers as well. So there are so many such examples of the ethical issues that we face day to day.
So, sir, how did you overcome it in your hospital?
So one thing is the frank communication, and one thing that I mentioned earlier is having a framework for allocation. So these frameworks and these ethical guidelines should be in place well before we face such situations, because during the situations there might be some knee-jerk reactions. So in the hospitals and the healthcare systems, it is important to recognize that we face these situations. So we have those protocols. For example, protocols for the bed allocation in the ICU. What are the criteria that will be taken into account? The life expectancy, the survival rate, the benefits that the patient will have, the chances of survival, how intense those protocols will be, vis-a-vis the availability of the palliative care, the benefits of the palliative care, and communicating this with the patient. Same is with the communicating with the healthcare workers also, that we provide them the PPE, the personal protective equipment. We take care of their needs. We provide them the flexible hours. They should know that we have got their back. Then only they will have the confidence. Once they have the confidence in the employer, then they are more willing to. The research also shows that if the priority access is given to them for any curative treatment, if no curative treatment, whatever the empirical treatment is there, whether it's drug or whenever the vaccine is available, if the priority access is given to the healthcare workers, their willingness goes up. So these are some of the things that the healthcare administrators need to keep in mind, so that the healthcare services can be better run, smoothly run during such crisis situations.
Thank you, sir. Given your involvement in science and innovation leadership program at SET Business School, how do you ensure that innovative healthcare solutions are implemented ethically and benefit all stakeholders, including the patients and staff?
Yeah, that's a very good question, and we know this is an evolving world, and that the pace of evolution, the pace of especially the healthcare evolution, especially in the field of IT, is very fast, and the legislation always lags behind the IT progress in not just in healthcare IT, but in general. The rules, regulations, guidelines lags much behind in this progress in the IT, and this makes it quite difficult and interesting for the people who are working at the front line to implement. And many times there are industry specific pushes also. Industry pushes those innovations, industry pushes those ideas, industry pushes those equipments so that the hospitals use it. And then there comes the ethical question. Many a times, what I have been the purchase officer of my institute as well for quite some time. What I have seen that these registering these industrial push, keeping in mind the ethical aspects, is very important. While deciding to have a new technology in your institute, in your healthcare system, it is also important to keep in mind whether or not this will actually address the issue of equality, or will it exacerbate the issue of equality. Let me give you an example. If a new technology, if a new treatment protocol has come, which is quite expensive, it is well researched and quite everything is okay. But if it is being given preference over the traditional treatment, will everyone be able to afford it? And if a particular section or if a big section of the societies cannot afford such type of a treatment, will it not further exacerbate the healthcare inequality that we have in the society? For example,
yes,
give you the example. For example, the robotic surgery is being pushed a lot. There are benefits of robotic surgery in many situations. But can we have robotic surgery for all the surgeries and all the situations? Is it not giving preference to those who can actually afford it? Same is for the organ transplantation. If we do not have fair and just policies for organ transplantation and organ allocation, then we'll end up in a situation where all innovations will be of no use, because then it will be beneficial to only those who can afford such type of transplantations in the private. So while innovation is important, we need to keep in mind that implementation of those technologies require careful consideration, need to look into things which are behind the scenes. Sometimes it is the industry's push, and then take a call. Yeah.
As a member of Telemedicine Society in India, what ethical considerations do you believe are critical when integrating telemedicine into traditional healthcare systems, particularly in terms of patient privacy and data security?
I'm a member of Telemedicine Society now for quite a long time, and I have seen the evolution of telemedicine in India. Uh, Telemedicine can play a big role, especially in the hard to reach areas in this country. And the problem that we face is again the balancing between having the telemedicine for the benefit of the patient, and at the same time regulating it. And probably you might be aware that we still do not have a law for telemedicine in India. So there is no act that regulates telemedicine in India. And this debate has happened many times in many forums in TSI as well as in outside also, whether we should have act or some type of rule or not. Many are in favor, many are not, because they think that if we regulate it, probably it would be a hindrance rather than a boost. But COVID actually forced it on us. And then the government came up with the guidelines, telemedicine guidelines, while the COVID was on, because it forced us, because patients couldn't come from home to the hospital. There were lockdowns. And then the only way they could get the consultation was through the electronic means. And then these guidelines were being made. These are quite comprehensive guidelines in which they have taken care of the patient confidentiality as well as privacy and data privacy as well. But still a lot needs to be done. And then again, this is again situation where we have to balance between the benefits as well as the threats. And there is a long way to go, and I think we still do not have a HIPAA-like regulations that are there in the US, which are quite stringent. But with the time, I think in telemedicine also, with its evolution and its wider reach, there will be better and better situations, better and better laws. Till now, with whatever guidelines we have, I think they are taking care of the patient privacy, data security issues. Yeah.
From telemedicine, I just got into my mind. What are your views about the electronic medical records that some of the hospitals are starting? I went to a hospital visit in Fortis, and they are currently working on their application for EMR. What are your views about it? Like, will it work in India?
Yeah, it's already working. The electronic health record, you probably are not aware. The National Health Authority has come up with the ABHA, that is the Ayushman Bharat Health number. I am not able to recollect the full form of the ABHA, where everyone will have ABHA ID. And their data would be portable, and this will be available on the cloud. And the electronic health records are being used in many hospitals already, including our hospital. Now, to what extent are we using is another question, because the acceptability at the doctor's end, the resistance at the doctor's end is always an issue. And I agree with them to some extent, keeping in view the workload that they have. The kind of patients the number of patients that they see every day in OPD or indoor, it's huge. So in that sense, to some extent, they are not able to provide maintain the health records in the electronic form. But that's the way to go. We have to have the electronic health records, and with the push from the National Health Authority and this Ayushman Bharat, everyone will have their health records in electronic form, which would be easily transported from one hospital to the another. So that's the future.
Are we working on something that can help the doctors overcome this problem?
That's a very important question. Now, as I said, there are limitation of resources. One easy solution is provide them an assistant, and then that will. But it's easier said than done, right? So private hospitals can do this. At least in the government setup, this has not yet been done. Some departments are better than others, so to some extent this is being done. What we are doing is that we are scanning the health record of the patients, and then we are attaching with their EMR. So this can be accessed. It is still handwritten, but actually it is in the electronic form, and it can be kept for perpetuity, long time. So yeah.
So, sir, my last question to you. You are in a position where you mentor future healthcare leaders. How do you instill the importance of ethical decision making and leadership in your students and your colleagues?
It's by walk the talk. It's by giving examples, setting examples. In Hindi we say आप न जावे सासरे औरन को सिख देत, यानी कि अगर आप खुद नहीं करो, यानी if you are not following it, it will not be effective to others. And there are so many stories. So the best, not just for this ethical behavior, best way to motivate others or teach others is by setting examples. It's by walking the talk. I'm not underestimating the value of the formal education. The formal education is very important, and the NMC has recently, if in last year or two, has come up with they have incorporated the ethics into the MBBS curriculum as well, which is a very welcome step. I think that is what we also try to teach our students there, at least in the students of hostel administration, the integrity, the ethical behavior, the uprightness, by examples, and giving them the bad examples also what we should not do. We have discussions in seminars about some of the scams that happen in the country or in other places. Some of the court judgments that have been in favor or against the cases of the medical negligence. We teach them by these practical examples as well. Yeah.
Thank you so much, sir, for sharing your insights. If you have a message for our audience, please feel free to share.
Yeah, thank you. I just want to emphasize again that the ethical behavior is very important, and in life, whatever we do, not just in healthcare, it is important that we follow the ethical principles. Thank you very much.
Thank you so much, sir. It has been an enlightening conversation. And to our listeners, thank you for tuning in to the Health Frontiers Insight from Global Experts. Stay tuned for more episodes. Until next time, stay healthy and stay informed. Thank you.